Well, it is a historical day for the health system. Just this afternoon, we have signed a letter of intent to enter into a strategic partnership by transferring ownership of the Memorial Health System to Catholic Health Initiatives, CHI, as we've come to know them, out of Denver, Colorado. You'll get to know more about them in the days to come, but we have their President and Chief Executive Officer, Mr. Kevin Lofton, with us today to tell you more about that organization and to talk more about this transaction. But this process started in 2011 when the board of this health system had the foresight to look out into the future and to create a 5-year vision for the health system. And in that, they recognized that because of this rapidly reforming industry and dramatically reforming industry, that independent health systems may have a more challenging time keeping their mission viable in the future than they have in the past. And so they set out on a journey at that point in time that we stepped up about a year ago by engaging an outside consulting firm, one of the tops in our industry, to work with the board and in a very, very analytical and methodical process over this last year to first determine what was the best position for this health system to be in going forward. And if it meant to take on a strategic partner, who was the best partner that could assure the long-term viability of this mission for the communities that we serve. And we worked with a number, we've had dialogue with at least a dozen different health systems over the last year, and we continued to work in that process to narrow it down to where it was clear that the obvious choice for a partner for these communities and this health system was CHI, or Catholic Health Initiatives. And so the Board of Trustees ratified that letter of intent earlier this afternoon, and we're here to announce it to you today. What the board recognized is that for an independent health system to be viable, it was going to have to develop significantly different and stronger competencies, core competencies, and characteristics, financial strengths and all, that it is very, very difficult for an independent health system to do. And while there was no burning platform with this health system, meaning that there was no imminent risk of failure of this health system, they were proactive and they saw, looked to the future and saw how this industry was performing and said that, while we're strong, we need to reposition so that this mission can stay strong for the long term. And the Catholic Health Initiatives organization, CHI, had made a huge pledge to the state of Texas and to our region, and one thing led to another, and here we are with this agreement. So we think that the best way to demonstrate what the board saw in CHI and why they feel like this is the best way to go for the communities that we serve is just to let them tell you. So our board chairman, Jack Sweeney, is going to introduce Mr. Lofton to you.
Well, I think Gary's already introduced him, but let me tell you a little bit about him. Kevin is the President and Chief Executive Officer of the Catholic Health Initiatives. He's got over 30 years of experience in this industry. He oversees a company that has 87 hospitals and hundreds of other facilities in 18 states, stretching from coast to coast. In 2007, he served as chairman of the board of the American Hospital Association, and he has other recognitions, too numerous for me to mention here. I will say this, I said this in the Board of Trustee meeting, that the one thing our board is absolutely convinced of is that Kevin and his team have this hospital's best interest at heart, the doctors in this community's best interest at heart, and they have the people of East Texas' best interest at heart. So we are extremely happy to have this relationship develop. And Kevin, we want to thank you and your team for all the work you've done to help us get this accomplished. So, Kevin Lofton.
Thank you, Jack and Gary. It's really an exciting day for us to be here with you. On behalf of my organization and all of our colleagues across the country, we're excited about the opportunity to be able to partner with Memorial and for many of the things that have already been described. Healthcare is undergoing major change in our country. We generally hear the buzzwords and phrases around healthcare reform and things like that, but what it really comes down to is that the model that we've operated under for many years in this country, one where we take care of people when they're injured, we take care of them when they're sick, is one where we have to really develop our systems to get ahead of the curve and focus on improving the health of the communities that we serve. So ultimately, that's kind of what we're really all about. And our pledge from CHI coming in and joining you in your community is that we will commit all of the resources that we have as a national organization, commit those to improving the health of the citizens in East Texas. And that's really what this is all about. On a personal note, I was born in Beaumont, and my first hospital administration job was in Corpus Christi at another Memorial Hospital. So I actually started my career at a Memorial Hospital down in Corpus. And I think that, you've heard a lot about our entry into Texas. Last spring, we were successful in acquiring the St. Luke's Health System in Houston. It's a 6-hospital system based in Houston with the flagship hospital in the Texas Medical Center. Just 2 days ago on Tuesday, we announced the culmination of 6 months of negotiations to redevelop the relationship that St. Luke's has with historical partners, and we're happy to say that we've developed a new model to work with both the Baylor College of Medicine as well as the Texas Heart Institute. So CHI is now a joint venture partner with the Baylor College of Medicine and then also with the Texas Heart Institute. And we can talk about Houston and all the things we've done there, but what's behind that, it means that not only is Memorial joining with CHI as a national organization, which we have a lot of resources and services that we can help bring to your community to improve care, but it also will link you to one of the foremost regional systems in the United States based in the Texas Medical Center and what is now CHI St. Luke's Health. So we're really excited about that, about the capabilities. It'll mean that that we will be able to co-brand Memorial with the Baylor College of Medicine so that we can add clinical capabilities to services that we provide here. And it also means that, that in terms of cardiovascular care, CHI will be making major investments to enhance the capabilities of the Texas Heart Institute, and it already has an international reputation, and we'll be able to work with your cardiologists and caregivers to again expand those services into the Memorial Healthcare System. So our model is one where we're not looking to export your patients to Houston. We're looking basically to help bring additional capabilities so that more of the care of people that are in need here in Lufkin and Livingston and other communities that you serve, that you will be able to provide that care and those services here in your community. So, and with our entry into Texas, in addition to the acquisition of St. Luke's, CHI made a pledge that for East and Southeast part of Texas, we will make investments that will total more than $1 billion over the next 5 to 6 years. And so that's a great enhancement to the economy. We will be able to help see the capital needs that Memorial has to be able to continue to expand services to meet the needs of the patients that we serve. So when we look at this type of relationship, a lot of the way healthcare will be built in the future is you do need a certain level of economies of scale to be able to provide services. You need those economies to be able to negotiate contracts with managed care payers. And basically looking at the way healthcare is provided, there are a lot of things that we can do because of our scale at a national basis that we can help to reduce the administrative costs here at Memorial, which will allow us to have more funds to be able to reinvest in direct patient care. I can tell you that a high priority at CHI is the quality and safety improvements that we work across our system. And one of the other benefits are that we are able to touch with our brothers and sisters across the country. We always have places that are doing some exceptional things. We have places that need improvement, and we take those best practices from one of our locations and help spread that knowledge across our entire system. So that's another one of the benefits. We will be able to make investments that will focus on leadership development, and that we not just look at the patients, but we also make sure that the employees and staff that work in all of our organizations are working in the best possible environment. And so we do have a lot of things that we invest in terms of employee development and the like. So overall, we are excited, and in time, we'll be looking to work with Jack and the board, and with Gary and his management team, to immediately begin looking at their strategic plans. Gary has identified some priorities for us, and we'll work through those and then look to see what would be the areas that we need to make the first level of investment, and what will be the areas that we would begin to move some of the CHI services to Memorial. We can tell you that our model is one that even though we are a large national organization, we serve 2/3 of the communities that we serve are rural communities. So there's a federal designation called the Critical Access Hospital, and CHI has more critical access hospitals than any other organization in the country. So we're very comfortable in urban settings and rural settings in terms of the things that we can do to help improve services, and we would look to work with the board on the strategic plan, and then decide what are the priorities that we would focus on. And then in time, we again would look to connect Memorial to the CHI St. Luke's Health, and then base that as a more regional system based out of Houston. So I'll stop there, and I'm sure that this is a media gathering, so that there will be some inquisitive questions I'm sure that people will have, and we'll be happy to try to respond to any questions that you have.
This isn't going to be your only chance to ask questions, but it's certainly your best one. Yes, sir.
Will there be any changes in management in the short term or long term?
Great question. Again, our long term, anything can happen. Our model is one that, again, even though we're a national organization, but we fully know and believe that healthcare is delivered locally. So in our model, we believe in a strong local board. So we've asked the current board to stay in place to provide that local leadership. Our model calls for us to add one CHI executive to the local board, and we will do that. And then Gary has agreed to stay on board. So at that point in time, in our model, the local CEO is a CHI executive, but the team that works for that CEO works at the pleasure of that team. So we do not expect any changes either at the top in the leadership for the foreseeable future. And also, obviously, in terms of the employment across the board, our plan is to grow Memorial. So this is not where we're coming in reducing jobs. We would look to grow jobs in the community. And there are some models where some of the services that we provide at CHI are nationally operated. So like, for instance, information technology as an example. So sometimes the local employee would be switched to our payroll, if you will, from that perspective, but they still work locally. The biomed people that fix the medical equipment, that's another one of those types of examples. They still work in the local community, but those people would be switched to the CHI payroll because that service is operated nationally.
I can add to that just on a practical basis. There's already been two changes in senior management here. One is that we became thrilled, and the second is we became much more confident about the future. And there's a disease running through our industry of uncertainty because of not only the significant but the rapid changes that are going on in payment mechanisms. And we've known through our work with consultants in getting in this process that we were missing some real key core competencies in our management processes and our expertise that we needed to shore up in order to thrive. And think of it this way: this health system has thrived for 65 years. Absolutely thrived. It began as a single hospital here with the contribution of some individual corporations here, and is now multi-hospital, multi-county, multi-service health system, the most comprehensive health system between Tyler and Houston. Very strong in our markets, but even with that, there were competencies that we need to shore up on, and it's very difficult for an independent health system to have the resources to do that. And so this shores those competencies up and gives us then that second good feeling of confidence going into the future of this industry.
Can you talk a little bit more about the history of CHI?
Yes, we were founded 18 years ago as the current organization. I've been with CHI, next month will be 16 years, and will have been chief executive now for coming up on 11 years. CHI came together 18 years ago by 3 large regional Catholic health systems, the Sisters of St. Francis Health System in Philadelphia, Catholic Healthcare Corporation out of Omaha, and the Sisters of Charity of Cincinnati. They were the founding 3, and then the Sisters of Charity of Nazareth, Kentucky joined. And when you look at that history, even though the organization as it is today is 18 years old, but many of our hospitals go back 100 years, 150 years in the various communities that we operate in. And really some of the same things that Gary talked about are some of the original reasons that the organization was founded, that at the time these systems were in the $1.5, $2 billion revenue range, and they recognized that far back that was probably not going to be large enough because of the way that healthcare was moving in the direction of larger organizations. So, so we do operate coast to coast in 18 states. Denver being our corporate headquarters. We have another secondary office in northern Kentucky, just south of Cincinnati. And at the end of the day, we are a part of the Catholic Church in terms of the organization. We do operate hospitals across the country, very diverse set of hospitals. We have the Jewish Hospital in Louisville, Kentucky as part of CHI. There's a Lutheran Hospital in Omaha, Nebraska as part of CHI. We operate 2 university hospitals, Creighton University and University of Louisville, and now with Baylor coming on, that will be the 3rd. So we have as diverse a portfolio in terms of the types of services that we offer across the country. And in terms of being future looking, we have made investments in virtual healthcare. We're making major investments in electronic health records. So when you look at the scale that we have, the types of investments are the kinds of things that, as well as Memorial has been run, and even a system larger like a St. Luke's, even systems that size today are not able to make the full types of investments to have the total level of expertise that it takes to operate in the healthcare of the future. We employ more than 3,000 physicians across CHI physicians and mid-level providers. And that only makes up 20% of the physicians that practice in our hospitals. So the bulk of our hospitals are private practice physicians as opposed to employed. But we put a lot of focus on our core values in terms of what we expect and the covenant that we have with our employees. We make a pledge to our employees what we offer them in terms of the type of environment, and then we have a covenant and things that we look back. So one of those is core values, which are reverence, integrity, compassion, and excellence. So when we evaluate our executives, we look at the what, like any company would do. Did the person get the job done? But we put equal emphasis on the how. How did that person go about doing it? Does it, and is it in keeping with our core values? So that's just a little bit about how we operate. We have a national board with people that live all across the country. In fact, one of our founding board members was Dr. Andy Van Enkenbach, who at the time was the #2 person at MD Anderson. He later went on to become the head of the National Cancer Institutes. He was on the founding board of CHI. And Dr. John Anderson, who was the chief medical officer of the Baylor Health System in Dallas, also served on our board and actually later became our chief medical officer. So we actually have had board members from Texas over the years. And we currently have Ed Speed, who lives in San Antonio, is also on our national board. So that's kind of how we operate. But as I said earlier, we do believe in local fiduciary boards, and so we do have the ability to, again, to continue to attract leaders from the communities, because at the end of the day, it becomes a balance between the local leaders, board and management, and then with the national leaders at CHI sitting together, planning the future, and making the best that we can for the people that we serve.
Kevin, can I add a few things about CHI that you probably wouldn't be comfortable saying? What we know about Kevin at CHI is that their reputation is the tops in our industry. Kevin personally was chosen by his peers, folks like me, over 4,000 of us across the country, who select our trade association leaders every 2 years, and Kevin was chosen to be the head of the American Hospital Association. And when you think of how many people there are, you know, the number of hospital administrators that could be selected over time, and only a handful of those, you know, get selected over a year. Coincidentally, we are blessed by the fact that one of the founding CEO of this hospital, Horace Cardwell, was president of the American Hospital Association. And so we've got the privilege now of this community working with two such individuals. But his personal reputation is impeccable. And that and other characteristics transfer to CHI in terms of being respected, you know, throughout the whole industry. And as I told you know, others before, in terms of the other organizations that had interest in working with us and submitted extremely strong proposals to us as to how we might partner. They were organizations that you would know well, have utmost respect for, and so, but we feel like honestly that we got the pick of the litter and the cream of the crop in this process. So that's part of that thrill change that I talked to you about before, to get to work with people like this. And the fact that it's a faith-based organization. I tell people about Memorial, we're not a faith-based organization, but you couldn't tell it by the people that work here and the way we behave, and by the culture, you know, of the communities that we serve. And so culturally, it is a very, very, very good fit to bring Memorial and CHI together, and to bring CHI to this part of the state of Texas.
And the leadership part that Gary, it's not just me. Kathy Sanford, our Chief Nursing Officer, is here. She's the past National President of the Association of Nurse Executives, and we can go through a lot of our other leaders across CHI. That one of the things about our role is that really the people who do the real work are Gary and the teams at the local hospitals, and so we do have the ability to focus on the strategies, to focus on looking out into the future, because on a day-to-day basis, I formerly was CEO of a 900-bed university hospital, University of Alabama in Birmingham, but I'm not doing that. So I do have the luxury of having people like Gary at the local level to lead the local hospitals, and then my team, we help them to focus on either capabilities that we're able to develop and bring to help them, or focus on just some of the strategies. And then so it's a healthy give and take and push and pull, because you know, we will bring some notions and ideas, and we'll sit down with the local team, and then together we'll figure out what's the best course for Memorial. And we have another Memorial too in CHI, and our system in Chattanooga, Tennessee is Memorial Health System too. So all of our hospitals are not saints.
Surely there's some other burning question that some of you've laid awake at night and wondered about.
You may have touched on this already, but what changes can patients expect in the months to come? What changes can patients expect with the transfer of ownership?
Well, I think in the next couple of months we're going to be working to close the transaction, but we obviously would begin to work with Gary in any way that legally we can in that regard while we finish that. I think for us it would be really, I talked about sitting down to understand the strategic plans and needs for Memorial. Gary has provided us a priority list for some of the capital investments. And we can begin talking about then some of the care modalities and some of the quality focus that we have. That happens to be a major focus of your board chair in terms of the quality and safety for the patients of Memorial. So beyond that, I think Gary would be better to respond to some of the initial changes, but what we would do would be to look at the types of services that we can add value and then sit down and prioritize which ones would be the ones we prioritize. So we believe me, we have more than we could bring at one time. So, but definitely a major focus for us would be around the patient quality and safety, and then initially prioritizing the strategic capital investments that Gary feels we need to make.
Andy, let me just mention, there's some other board members here, and they may want to make some comments as well, but when the board started this process, we basically set out 3 goals. We wanted to stay nonprofit, if at all possible. We felt like that the people in the area looked more toward Houston for health care and were more aware of the hospitals there if they had to go out of the area. So we wanted an affiliation with Houston, and we wanted someone who would make a capital commitment to this area, right? We also got, I think in addition to that, we got a comfort level that this is not being done to pull patients out of Lufkin to Houston, okay? This is being done so that we have the services and the expertise here for patients to stay here unless it's absolutely necessary for them to go. And then when they go, they're going to have a connection there that we might not have had in the past. So that was really a 4th thing that came out of this that made it even a stronger fit for us as the board of the hospital. And Patricia and Jay are here. You may want to, if you have anything to add to that, well, feel free. But we got an extra benefit, if you will, from this connection with St. Luke's or CHI, and we're very, very pleased with it. I'm like Gary, this is a big deal for this area, and it's not just a big deal today. It's going to get better as we go along. We could have certainly survived as a standalone hospital in Lufkin and with Livingston and the surrounding hospitals, but we didn't want to be average. We didn't want to be an average hospital that provided average care. We wanted to be the best. We wanted to provide the best care that we could possibly provide, and we think this was the right step to get to that level of care, and it's a very long-term commitment on their part, and it's certainly going to benefit this area for a long time to come.
I think the trustees heard one comment earlier today. They want to become a regional growth process, and we are a part of that strategy. And so this out-migration has to stop if they want to be a regional growth area. And I think that convinced the trustees that you were looking at helping us grow and not allowing us to diminish in our service.
Some of you are aware that the Chamber contracted with the State Department of Commerce to conduct a study about the magnitude and the importance of the healthcare enterprises to the local economy. And for some folks, the results were really staggering. For those of us who have been in other communities and have been in the industry for a while, we recognized that healthcare accounts for about 20% of our local economy. 1 out of every $5 that's spent in Angelina County, and we can transfer that out, is spent in healthcare. And so it is absolutely essential to the local economy. And when you look at the changes in our local economy over the past 10 and at least 10 years, and you could go back and see how we've lost some major industries, paper and so forth, you would have expected, a loss in employment numbers. It's actually grown, and when you look at the reason why, it's because of healthcare. And that investment that CHI is willing and committed to make in this health system over the next 5 to 6 years is significant, and it's only going to expand the magnitude of healthcare as an economic driver in this area.
Another part of Lufkin, we just announced a new facility, the Burke Center, which is basically serves up an area of the population that is underserved in almost every area. We have the health district here in Lufkin that just got a large grant from the state, moved into a new building. They serve another part of the population that badly needs to be served. We have a college here, a community college, that has a very, very highly rated nursing program that's been put together to feed into this. So, and another hospital in town. So when you take that and put it all together, it, I hope, makes it a very attractive place for you to come. And as you learn more about us, you're going to see those things are not only here, they're growing and they're well supported, and they really do. I think we have the opportunity to cover the population in this area, from the poorest to people who can't afford to come to the hospital. And that's important for all of us. It's a legacy thing for this area and this community, I think, to be able to touch all those different segments of the population. And I know you try to do that too, and the work that you guys do.
And if I, just on that point to elaborate, because again, the emphasis was made that that Memorial wanted to remain nonprofit as possible. So historical part of our mission is care for the poor. That's one of the founding principles, being a faith-based organization and a nonprofit organization. When you total up total charity care and then a broader definition that they call community benefit, and that the formulas in terms of how that's all calculated. CHI across the country, we provided almost $800 million last year, $800 million in free care, charity care, and community benefit services. So that's definitely a part of our mission, and we take care of anybody in need, regardless of ability to pay. Obviously, we like to collect when people can pay, but at the end of the day, that's a big part of our mission. So, so we would carry that forward. And another part of when I mentioned healthier communities, there are a host of things that we do to back that claim up. And one of them is that we have essentially our own kind of internal foundation, if you will. We call it our Mission and Ministry Fund. And all of our local affiliates can submit grant applications to receive funds from CHI to do projects that would enhance, under a global terminology of enhance the health of the community. And we, for instance, have a nationwide focus in all of our markets around violence prevention. So that's one thing that we've taken up as an example of beyond the walls of inside the hospital, what kinds of impact can we have to the community at large to improve a community. And when you look at violence in our societies, unfortunately, the disruption of family life, the increased cost of healthcare, and all of those kinds of things like that. So every one of our markets has to develop a program. We don't tell them what the program is, but the programs have ranged across the country around reducing gang violence, domestic violence, violence in the school system. Most of my colleagues and I live in Denver. We've been struck by several school incidents, as you all know. I mean, those kinds of things like that. So we'll be looking for Memorial to develop a project. We will fund it from CHI around violence prevention. So that's just an example. Some communities it involves housing. So it's a lot of things like that that we look at the world of improving health beyond just the delivery of medical care.
And by the fact that we're staying nonprofit, it allows some of the local foundations to continue to support this hospital like they have in the past. And that's the Kurth Foundation and the T.L. Temple Foundation. That can carry on by us remaining a nonprofit. They're very supportive of that, and we're going to use those funds very wisely as we go forward to complement what we're trying to do here every day.